Assess the environment for potential dangers and establish a safe environment. Ensure full PPE. Assess the patient's level of consciousness both verbally and by eliciting a painful stimulus. Shout for help and activate the emergency buzzer. When local help arrives, ensure that they go to call 2222 and activate the cardiac arrest team. Lay the patient flat. Recognise cardiac arrest. Look for the absence of signs of life and normal breathing. Feel for a carotid pulse if trained to do so. Do not, I repeat, do not look, listen and feel for breathing by placing your ear and cheek close to the patient's mouth. If there are any doubts about diagnosis of cardiac arrest, the default position is to start chest compressions until help arrives. If an oxygen mask is in place, leave it there. If an oxygen mask or face mask is readily available, put it over the patient's airway, as this will limit aerosol spread. You have confirmed cardiac arrest. Place one heel of the hand in the centre of the patient's chest. Interlock the fingers of the other hand and ensure that the pressure is not applied over the patient's ribs. Keep your arms straight. Position your shoulders vertically above the patient's chest and press down on the sternum, 1/3 of the depth of the chest. After each compression, release all the pressure on the chest without losing contact between your hand and the sternum. Repeat this at a rate of 100 to 120. At this point, continuous chest compressions until help arrives. When help arrives, they will leave the cardiac arrest trolley outside of the room, bringing the bag valve mask into the room. Attach this to 15 litres of oxygen. Remove the oxygen mask. And replace with the bag valve mask, covering nose and mouth. Ensure there is a good seal and tilt the patient's head back to open the airway. When this is done, inform the chest compressor that you are ready. The chest compressor can then deliver 2 ventilation breaths by squeezing the bag gently, approximately 1/3 of the bag. Continue to do 30 chest compressions to 2 ventilations until the cardiac arrest team arrives. Limit the amount of people that come into the room.